All right. So I'm Jason Roostaeian. I'm a plastic surgeon here at UCLA. Just a little bit about me. I'm very tied to UCLA. I think I graduated there probably 4 or 5 times now. I went to undergrad there, med school, graduated my residency. I matched into plastic surgery directly out of medical school. And so I had a 6-year training program where I did a combination of general surgery and plastic surgery there. And then I did 2 fellowships. I did one in aesthetic surgery, and that's where I gained a lot of my interest in facial aesthetics. I went to Dallas for that, and it's a kind of a center, an academic center that focuses on facial aesthetics. And I got a lot of my passion for facial aesthetics there. And then I came back to UCLA to do complex microvascular reconstruction, where I do a lot of facial reconstruction, and also was the aesthetic clinical instructor. And a lot of what I do now is facial aesthetics, and then also some reconstructive as well for cancer. And I like to focus mostly on the head and neck and facial anatomy. And I read, publishing about it, and written some chapters and everything on facelifts and also rhinoplasty. So just a little bit about me, and then today I want to cover the process of facial aging, what's involved with that, and kind of go through some of the main things that we, both as patients or as plastic surgeons look for in terms of facial aging, and things that often bother a lot of people, and kind of approach that from a top to bottom fashion. And then I want to talk about both non-surgical and surgical options of what we can do about it. There's a lot of advances more recently that I think it's important to touch on. Some of them, more or less proven than others, but I'll go over that. And lastly, there's a lot of myths out there that patients have, so I think it'll be important to address that for you guys. As far as questions, if you guys have any questions, I'm okay with you, kind of raising your hand throughout the lecture. I like it to be interactive, so feel free to chime in, and if you have any questions, I'm happy to try to answer them. So in terms of facial aging, what happens? It really goes all the way from skin down to bone. In terms of the skin, there's a loss of collagen and elastin. The loss of collagen thins your skin, and the loss of elastin, you lose that ability to kind of stretch the skin and have it bounce back. So that's where you get a lot of the excess loose skin as we age. But deep to the skin, there's also fat, and the fat is a very important component that kind of fills out that skin. And you have both a loss of the fat and redistribution. You tend to lose a little bit of that heart-shaped face, losing the fat around the cheek and getting it more, unfortunately, down around the jawline, going from a heart shape more to kind of a pear-shaped or squared-off jaw. And part of that also comes from a loss of the support of the facial support structures, the ligaments. It's all ligaments in your face that kind of hold, the skin and fat in place, and it's most likely from gravity that they tend to stretch and get loose over time. But even the bone, just like people have like bony changes from osteoporosis, a lot of females have to deal with, the facial skeleton also tends to thin out and change over time, which is also another important. And so again, as the deepest layer, you lose some support, and so those are kind of an explanation of what we see as we age. So here's just a schematic of a youthful face and an aged face. Obviously, it's just a cartoon, but what's the common, if you compare that right side of the screen to the left side of the screen, what's the most common thing you see, and try to pay attention to mostly this line, the line. What's the big difference between that line? Anyone want to hazard a guess? Huh? Yeah, well, so this line here, there's a smoothness to this side of the face. It's a very straight, clean line. There's a convexity. It's not all broken up and jagged like this line. And that, breaking it up essentially, and it's probably best exemplified in the eyelid cheek junction. We don't like to see eyelid cheek junction. This is what we call a tear trough deformity. I mean, it's actually very natural, and a lot of people have it, but it's a separation between the eyelid and the cheek here. And that's one of the common findings with aging. And just kind of going from a top to bottom fashion, you'll notice a receding hairline, a longer forehead, and obviously the wrinkles you see with that. And then another common thing is what we call lateral hooding, excess skin lateral to the eyelid. A lot of people think they need, and I'll go into, give you examples of this, that they need upper eyelid surgery to remove that, but it's really a brow lift. You need to put the brow back up in a good position because this tail of the brow here is in a nice high position in youth and drops down over time. And with that comes excess hanging skin. And then when obviously the upper eyelid, you get excess skin, but you also see an excess amount of fat. Most commonly, we see it right here, what's called the medial fat pad. You see some excess fat, and that bothers a lot of people. And then in the lower eyelid, we see, it gets a little more lax, a little bit more rounded out, but, there's, a mix of excess skin often, as well as excess fat that's in the actual, eyelid, and then, stronger demarcation of what we call the tear trough deformity. And that plays into, the loss of facial cheek fat, because a lot of this was previously built up by cheek fat, and as that went away, it became more apparent. And then as you go down the face, that the loss of the cheek fat up here and more down towards the jawline causes a more prominent, what we call the smile lines, or in medical terminology, we call them the nasolabial folds. And then that goes into we call the marionette line and jowls. Again, that whole concept of facial fat redistribution and losing it in good areas and gaining them in less good areas. And then in the neck, there's something called platysmal bands. You have this really thin muscle that's just right under the skin, and you see those two bands. I'll show you examples of that later as well. But these are kind of like, the main things. Did I miss anything? Anything that bothers anyone that wasn't on this? This is pretty complete, so I thought it was a good schematic. So what can we do about it? There's both non-surgical options and surgical options. The mainstay for non-surgical options, these are not all of them, but these are the ones I'm going to focus on. And when I'm talking about newer technologies, I'll go over a few more. But Botox, fillers, and then skin resurfacing. Those are our mainstays, and I'll go into more detail of each of those. And then the surgical options basically have a surgical option for each of those things I talked about, whether it's the brow, the upper lid, the lower lid, the facelift, which really addresses the cheek and the jawline, and then the neck lift, which addresses the neckline and those platysmal bands. So we'll go into depth of each of those. So pros and cons for each one. Non-surgical options tend to have much less downtime, right? They're less expensive, but they require maintenance. So a lot of times when you add up the incremental cost you're spending on non-surgical options, it adds up really fast, and you never get the result that you would have from surgery. So it's something to keep in mind. It's limited results, and they tend to be temporary. Obviously, there's less risk, but with cosmetic surgery, we really do everything to minimize risk. You first of all have to be healthy. I mean, that's number one. We got to make sure it's safe. If you're going to look better, you got to be healthy to do so. So we really minimize the risk with anything we do electively for cosmetic surgery, and that's probably one of the most important things. When you talk about surgical options, obviously there is more of a recovery, but that's you at the end of the road get a much more of a result. So it's important to keep that in mind. And it's nice, I mean, as a plastic surgeon, I'm proud to be able to offer both. And that does make a difference. Like if you see a doctor that doesn't offer any surgery, you're probably not going to get offered a surgical option or even entertain that as an option. So there's certain things, like we still don't have a great answer for skin excess. I mean, if you have a lot of excess skin, there's nothing that tightens skin enough or gets rid of that skin excess other than cutting it out. So that pretty much requires surgery. So you just got to be honest with yourself and really think about it, and hopefully this talk helps and kind of helps you guide your decision as far as what your goals are and what you're trying to achieve, and whether it makes sense to consider, because I think non-surgical options are great. They achieve great results for the right patient, but sometimes surgery is the right answer as well. So everyone's afraid of this, right? So nobody wants to, this scares me. I would never do plastic surgery. So I mean, one thing to keep in mind is you don't only notice bad plastic surgery. I mean, this is a patient of mine, and if you look at her before and after, would you think she had plastic surgery? I don't think so, but it's up to you to decide. But, I think it has to look natural, and I think communication is key with your patient, what you're trying to achieve. And every surgery needs to be individualized. So it's not like pull the skin the tightest, or, there's not, so I think it gets lost sometimes. And it's a lot of times people who haven't been trained properly in what we do in aesthetic surgery and non-plastic surgeons that get those type of results. So it's important to keep that in mind. Good plastic surgery should be invisible. It should always look natural, and I really focus on that. So it forever. The surgical result basically sets back the clock, however many years you consider that.
No, but I mean, I understand it lasts about 10 years.
That number is based on the fact that most people will consider a revision facelift at 10 years, if not 15. So the result really lasts forever because you turn back the clock. We're not going to stop the clock, but we're going to turn it back however many years you think that turned it back for a patient, and it's variable depending on the result. But at the end of the day, that number that people throw out, like usually, that's really when an average person may consider getting a touch-up.
So,
but they're still often better than they started, even at the 10 years.
But is it because the muscles?
Because you keep aging. We don't stop the clock, right? So your skin is still going to lose collagen, still going to lose elastin. Now we put it all in a better position. But that whole process of aging, we can't stop, unfortunately. I mean, if we figure that out, I'd be out of business. But that's okay. I'm okay with that. But it's so I think that's the concept to keep in mind. The result really lasts forever, but we can't stop the clock. So just to go through some of the non-surgical options, I'm going to just start with Botox. So Botox, very common, and we're doing it in younger patients. So it's basically a naturally derived protein that paralyzes muscle. Very different than fillers. A lot of people get confused about it. It works really well around the forehead and around the eyes. So crow's feet, the glabella, and the forehead. Those are our three most common areas to treat. And there's a few others that we do sometimes, but by and large, I'd say 90% people focus on that. And basically, it temporarily paralyzes the muscle. So a lot of the wrinkles people get, especially around the forehead, for instance, and I'll show you an example of that right here, is caused by this muscle is called the frontalis muscle, and it has a vertical pattern like that. Because it contracts that way, you get these wrinkles across the forehead because it bunches the skin, and when you do that recurrently, that's what causes the wrinkles. So when you can paralyze it temporarily, it will soften those, and they're called dynamic wrinkles because they're formed from muscular action. And so it will not only prevent you from forming the wrinkles. So I've people that are in their 20s getting Botox, and I'm not whether that's right or not, but if you're going to ask me, does it prevent the wrinkle? Yes, because the wrinkle is formed from the muscle activity, right? So if you can prevent that from happening, it does prevent the wrinkle from ever forming. Or for the older patient, it prevents it from getting any worse. And it will smooth a lot of the ones that you see currently. Whether it'll take away every single one and completely smooth your forehead, you don't know until you try it, because once you paralyze the muscle, then what you have left is ones that have gone on so long that the wrinkles essentially there, whether you have the Botox or not. So this just shows how it essentially works. And another common area is like these what we call the levins, and that's from muscles here called the corrugators. We treat those, and then obviously a lot of people want the crow's feet treated as well, which is from the orbicularis muscle, and we're able to treat those. When you treat this one here, you see how this muscle is coming down that way. When you treat that, it allows a little bit of brow elevation that a lot of females like, but you have to conversely keep that in mind when you're trying to treat the transverse wrinkles you get in the forehead, because if you paralyze this muscle, a lot of people rely on that muscle to lift up their eyebrows. And so it can drop your eyebrows a little bit. So we counteract it with paralyzing this one as well. But sometimes if that's going to bother, some people are really relying on this muscle, then you got to really start considering the brow lift procedure or something else, because you are constantly firing that muscle to keep your brow in a position that you're happy with. Yes?
Botox more natural than surgical options?
That's an interesting question. The result? I'm going to show you surgical results, and so I would say no. So I think every surgery should and can look natural. It should never look overdone, and I'll show you some. And it's surgeon dependent. So some of the top questions we get: when do you see the results of Botox? It takes 3 to 4 days to even kick in, so you don't leave the office with a result. You just trust that it's going to happen. The best results about 1 to 2 weeks when it's fully kicked in. And how long does it last? 3 to 4 months. That paralyzed, so it's never permanent. And I get that question a lot. So it's only lasts 3 to 4 months. I want to do it. If you really think about it, though, that 3 to 4 months of giving your skin a complete break lasts forever, because it's like your skin took a vacation for 3 to 4 months. It's a good vacation, and it will forever remember that it prevented the wrinkles from getting worse for that whole 3 to 4 months. In terms of maintenance, you probably want to do about twice a year, and then in terms of cost, we do it by the area at UCLA, and it's about $400 the first area, and then $200 the second area, and the third area is $150. So it's in the hundreds of dollars. You're going to do it twice a year. It does have dramatic, benefits to your skin. I've done it myself. I'm teaching residents, stuff like that. It's very safe and minimal downtime, and you could get a tiny little bruise that you can cover with makeup that night. So it's a very safe option. We use the smallest possible needle. It's a 32 gauge needle, which is like, have you ever had a TB test?
Is it like a baby needle?
It's the smallest needle made. So yes, you feel it, but it's about the least painful thing you could do. Really? Between that and fillers, yeah, it's less painful than fillers, and it's a very small needle. Yep.
Can you do Botox and decide later to do surgical options?
100%. Actually, and I actually, for when I'm doing a brow lift, I actually have people do Botox the week before, because I want to preserve exactly where I put everything and don't want the muscle to fight it. So it's not something I don't think anyone else really does or that I've written about yet, but it makes a lot of sense. Yeah.
Since the face has muscles, if you do like facial muscular exercise, does that tend to produce wrinkles?
The more you animate your face, the more you would get wrinkles. You got to live and talk and but yes, the more you animate, the more wrinkles you would get. So if you can try to avoid raising your forehead a lot, then less wrinkles you would get in your forehead.
The more you use your muscles, the more you would tone.
The toning, there's not a toning effect that would like smooth out, if that's what you're asking me. The using your muscles and getting them more active will cause that skin to form more wrinkles. Yeah, it's not like working out like your abs and getting a smoother, no, that wouldn't work, unfortunately. Yeah, not a bad, reasonable thought though. Yes.
So you said, like, what is a region? What you consider?
Yeah, so the forehead's one region. So there's the three, right? So the forehead, the glabella, which is where you form the 11s. Let's show them the prior one. Yeah, these, and then the crow's feet. Yeah, so 1, 2, so the whole forehead's one region. So
right.
Yeah.
So you don't go by CC.
But a lot of people do it by units, and a lot of people outside of UCLA, they share bottles between people. So sometimes you could find it cheaper, and also if it's not a doctor injecting it. But I inject myself because I want to have control over it, and I don't want to give it to anyone else to do.
And what is the mixture don't you have to mix it? Isn't it a powder form?
It's in powder, and you put it in a saline solution. Everyone does it differently, so I do it 4 units per 0.1 cc. Getting technical, but yeah, it's okay. And when I do in the forehead, I do like multiple places to get a broad spectrum, and I do 2 units each area, each dot. I do a 4, so I do a 0.05, because I don't want huge blebs in your forehead because it looks like a bad mosquito bite. There's a reason for everything. You just have to think about it. So fillers, moving on. So fillers are very different than Botox, and they're used to treat different things. Fillers, the most common filler, the substance is called hyaluronic acid, and hyaluronic acid is essentially, just think of your cells, they're not floating in thin air, they're sitting in a sea of mostly this substance. So it's almost like adding water to the sea. So it's a very safe substance. It's actually reversible, which is very important to know. There's a enzyme called Hylenex that can reverse the hyaluronic acid. So if you happen to hate the filler result, we can reverse it. So there's, that's important to know. And the areas it's used to treat is very different than Botox. So like where everything was kind of up here for Botox, the fillers work really well to fill eyelids, the smile lines here, and the cheeks. A lot of people also like to try to fill in this line, but the one thing I don't like about that, like I said, you have more redistribution and a heavier jawline there. It's kind of counteractive, right? You don't want to add more volume there to try to fill in that area because it doesn't look youthful. If anything, you want more volume up at the cheeks to get that heart shape back. So a lot of people do that, but I don't necessarily agree with it. And it's probably, if you're going to have an unhappy result, that's the most common one to me, where you see minimal and then they look heavy down here. It doesn't look good. So at that point, when you start really getting bothered by your jowls or your marionette line, I mean, you really got to start thinking about surgical options and a facelift really. So unfortunately, I mean, we don't have other, great options for it.
Do you use fillers if you have troughs?
The tear trough?
Yeah.
You can, and that's an area, that's the thinnest skin you have on your face, right in the eyelid. So it tends to be an area that can potentially be more palpable and have a little bit more variability in terms of people, maybe having, not being as happy with it. I would say the cheeks, every single patient I do the cheeks, and I'll go over the specific one, I haven't had an unhappy patient yet, knock on wood. I mean, like, there's ones that the smile lines, never had somebody unhappy with that because everyone likes getting that filled. Lips is another one that most people are really happy, and you got to do them appropriately, and I'll give you some examples here.
Some doctors use your own fat.
Yes, and I'll go over that too.
Oh.
Yeah, it's all coming. That's surgical though. So how much does it cost? It ranges, I mean, basically around 500 to 1,000 per cc. And the results are immediate. And you actually, there is a little bit of downtime in the sense the first 48 hours or so you have excess swelling. So it's not something you would want to do right before, especially in the lips, I would say. You don't want to do right before whatever engagement you're trying to get to. You want to give it about a week. It also can be some bruising as well. And it essentially fills in areas of a lack of volume. Like I said, it just adds extra volume under the skin, and it could help fill, the smile lines here. This area works okay, but as you get down closer to the jaw, I don't think it works well. But also filling out the cheek as well, and this is just an example of that. Here's another example of the smile lines. So a lot of people are happy with these type of results. And then the lips, tends to be in younger patients, but I think lip atrophy is something that you definitely see with aging as well. And you can do it without going all the way to here. So you don't have to, a lot of people are like, I don't want those duck lips, and trust me, they don't have to be duck lips. Like, here's a example, I think both these, like, you don't necessarily know that they have fillers, especially this one, in the lips. They can look very natural, and they're very happy patients. Yes.
Is it safe to use fillers on people who are older, like
Yeah.
65 and above?
Yeah, it's very commonly done actually. I mean, we do it all the time, and a lot of people, especially those areas like people with the smile lines and everything, that's they don't want to do surgery. They absolutely just don't feel like they'll ever be a surgical candidate just because that's them, and so they rely on stuff like fillers to get an improvement, but not it's not always optimal, but it's an improvement, and it's very safe. Yeah, these are a couple patients that I did lip filler on, and I think they look very natural. So there's a new product called Voluma. I mean, it's not that new anymore, but it came out like late 2013. It was specific FDA approved for the cheek, to add cheek volume. And it lasts 2 years. It lasts longer than the average filler. Most fillers are in the 6 month to 1 year range. This one lasts twice as long. So this one's the one that's $1,000 per cc, but it's actually, if you do it per unit time, it's a pretty fair price. And it's thicker, and so that's why it lasts longer, and it's meant to go close to bone. So it works really well for the cheek. Sometimes you could bring it around and help a little bit, like I was saying with that eyelid, sometimes just building up the cheek helps kind of blunt that tear trough deformity, and so it does help with that as well. So this is one that I think most patients are really happy with, and I always start with 1 cc. Some people sometimes want 2 cc's, but I think if you start slow and it's incremental, then you see a result. And I always inject one side of the face so you can kind of see what you're getting, and then we do the other side. And again, this one's reversible. We could reverse it. I've never had to do that, but if you happen to hate it. Just an example of that, the volume, you can see the improvement in the cheek here. So the last one for the non-surgical options is skin resurfacing, and really meant to reduce fine lines and improvement in texture and color. It's very, superficial in general. And there's three main options. It's chemical peels, lasers, or dermabrasion. They have the same pathway at the end of the day. They're, this one's a chemical burn, this one's a heat burn, and this one's a mechanical burn. So they all end up in the same place, and it's really up to the person. So there's nothing special or magical about the laser. It also burns the skin, and that healing process lays down extra collagen and causes a remodeling that smooths the skin, and also causes improvement in the texture and color often. And it's really dependent how much downtime you have is really dependent on the depth. The deeper you go, the more wrinkles you're going after, the more downtime you're going to have. So it's important to keep that in mind. And that really plays into when you do it around the mouth, and I'll show you an example of that. But this is just like a TCA peel, and you can see the improvement in the fine wrinkles and here in the color. And
Is it painful?
yes, it is a little bit painful. Both the you feel the burn, but we do we do at the minimum of a topical block. But sometimes, especially if we're going deeper, we will do like a local block with lidocaine and everything to make your skin essentially numb. So there are ways around that. Mm-hmm.
Is there a risk of scarring with all this burning?
Of course. Again, you have to go to somebody who knows what they're doing. And that's where I think, so the perioral rhytids are the deepest wrinkles often. And I think nothing works as well as dermabrasion for that, because you can go layer by layer and like watch it as you're going. When you do a laser, you push a button, it fires, and then it's out of your control. It's not in your hands. When you do a chemical, the only chemical that goes deep enough is called phenol. You got to be on a cardiac monitor, and it can really burn people. So this is the safest one, and it's a limited area, so it works well. So dermabrasion, you don't want to do a whole face with, because it'll take you forever. You're literally sanding down the skin. But when you're talking about one area, and I often do this at the same time as I'm doing a facelift or something else, I usually just throw it in, and it takes about 30 minutes. So you're under general anesthesia anyways, and it's a good time to take advantage of it. Just something to keep in mind. But you could do this in the clinic too, under a local block. So that's why I put in non-surgical options.
If you have like certain types of skin, like
Yeah,
large pores,
it helps tighten pores in general. So that's not an issue. But darker skin people have a risk of pigmentary changes, most importantly.
but I mean, like each procedure is a little different. So which one would be best for large pores, to reduce large pores?
Honestly, if you're talking, I think the way to think about it, I would say dermabrasion for anything around the mouth, and then outside of that, lasers or TCA are the mainstay.
And you can combine them?
No, I wouldn't do them together. You would do them separately. So some people prefer TCA. It's practitioner dependent. I like chemical peels, and some people like lasers more because that's what they have. It's not. The end product is the same. I think the peel is nice because you can kind of coat the whole face very evenly. The laser, you got to remember, is like kind of a grid pattern, and you got to like go across the whole face and try to hit angles and stuff like that. You don't deal with that with a chemical peel. So personally, I think you're at a disadvantage with a laser when it comes to a large area like the face with lots of curves and turns and everything. But they both work, and people will do both. But that's my bias as far as what the benefit is of doing a chemical peel versus a laser, again, because the end pathway is the same. You're essentially burning the skin. So, yeah.
How does that work with people with skin sensitivities, like rosacea? Of the three options, which would be the best?
I mean, I think the main area that you have to be exceedingly careful with is people with a darker skin tone, because there's a risk of hypopigmentation. If you have darker skin, it becomes more apparent. Now, there's a few things you could do beforehand, like be on hydroquinone. You also want to be on viral prophylaxis, so you don't, because a lot of people have herpes and it'll cause a viral flare. So there's certain things we do to make it safe. But in general, the darker your skin, the more risky it is because of the hypopigmentation. So I wouldn't recommend it for darker skinned people. luckily biology, darker skinned people often don't need these procedures because they have thicker skin too. So
How long does it take to heal, the burning and?
yeah, so again, it depends on the depth. So if you do like, a more very superficial coat peel, it's faster. But let's say in general, like a deeper peel, which would be like a 30% or above TCA, you're talking about a minimum of a week of where like your skin's really kind of looks, burned essentially, and you're waiting for the skin before you could like even put on makeup. Essentially, you're like just coating it with like Aquaphor or a moisturizer, and then at that point you could start putting on makeup and everything once it's reepithelialized.
That's another question. Is there a limit to how many treatments you could have in a year or?
Yeah, I mean, I wouldn't. You don't want to do them back to back or anything like that. You want to. I mean, so yes, you want it to kind of fully heal. I would say, space them probably about 6 months apart at least.
I do that every 6 months.
I mean,
I just know somebody who does that, so.
yeah, I mean, yeah, it's once the skin's fully healed, and it would be fully healed by like 3 months. I mean, you could technically, but like, what's the point then? You're constantly just like, you finally got to your end point, and then you're gonna burn it again. I mean, there's a goal to like kind of look good at some point, I think. So, yeah, and then when it comes to non-surgical options, a lot of people can do them, obviously. So just be smart about it. Just even dentists are going to do Botox and everything, and you get sometimes what you pay for, and it's a lot of nurses do it and stuff, and it's just something to be mindful of. Try to look at reviews and everything, and or go to word of mouth is still probably king in this business as far as like people that have experienced a good result and everything. So I think it's just something to be mindful of, because there's a lot of you guys are bombarded by a lot of advertisements, I know. So.
Is there like quality levels in terms of the materials, like Botox and the fillers? I mean,
Yeah, I mean, there is like, I will say like at UCLA we have to like, so one thing that we do at UCLA that I guarantee you most practices do not do, it's always American Botox, which is like an FDA rule, but I just know that it's cheaper if you get it from other countries. So I know, sometimes when you get cheaper Botox, there's no, the cost of it is not, it's not cheap actually. And we only use 1 vial per patient because we want no risks of infection, because we have to, hold ourselves to the highest standards. And whereas, it's very rare to get infection. You use sterile technique, you put alcohol, but most practices out there will share vials. So they'll get the biggest vial, which is cheaper, and then, share vials between people. You can ask them about it and be like, I don't know what they'll tell you, but I guarantee you, just based on the cost, because literally, like for instance, if you come in and get 1 area of Botox from me at $400, I make 0. That's cost. We offer it as a service. And we do more areas and stuff like that, we maybe make a little bit, but just so you know. So it's more like a service stuff thing for us, and we, again, it's always American Botox, 1 vial per patient. But, we just hold ourselves to a little bit, a safety standard that maybe is not always out there. Okay, so I'm just going to go kind of top to bottom in terms of surgical procedures. I mentioned the brow lift, and really the main area it's meant to treat is this lateral hooding, but also putting the actual eyebrow back in a more youthful position, which is up higher. Your lateral brow really, in most females especially, should be not a little bit higher than the medial brow, ideally. And a lot of people think this is eyelid skin, but it really isn't. Everything lateral to what's called your lateral canthus, or that corner of your eye, is really the brow skin hanging down at that point. And so you really got to consider a brow lift. I'll give you an example of sometimes when you got to just carry the upper eyelid all the way out here in people who have like tattooed a super high brow because you can't elevate it. I have an example of that. So it's all the incision. How's it done? The incisions are hidden in the scalp, which is really nice. So it really, should be very difficult to see. As long as you have a normal hair pattern, which most females do, becomes a little interesting in males sometimes. You got to be strategic.
how large are the incisions?
It really varies. I would say in general, my most common procedure, if I'll show you a couple examples of the ones that I've done. I tend to do what's called a temporal brow lift, and it's about a 5 centimeter incision out here, deep into the hair. So, and it allows, Yeah, you got to do both sides unless you're only doing one side. But.
Wow, I mean, don't you have to get rid of your hair?
No, we don't shave the hair or anything. We just work around it. I use half the time I'm wondering if I'm like a hairstylist, but I like, I literally have a comb inside the operating room and like use rubber bands to part them, and it's really annoying. It takes like 30 minutes. I'm like, I went to med school for this, but. Huh? Yeah, but we wash that off. We wash it off. Yeah. It's not a big deal. Very manageable. We do it all the time. It's not a big issue. And then, but sometimes, somebody has a really bad hair pattern where it's really receded. You can't go and pull things back further. So you got to be strategic. You got to sometimes do it right in the front of the hairline. But I guarantee you when it heals well, and I'll show you an example of this, you're not going to see it. So there's a lot to think about in this. And then again, it's a very surgeon dependent. Everyone has their own plan. So it's got to make sense. So really go through things with people and yeah. So to be honest, for the hair, when it's that deep, I prefer staples because it's not circumferential. So you have less chance of losing hair. When you do a circumferential wrap with a suture, it's instead of pinching it, so it helps preserve blood supply. And that's very common. Like it's better, in my opinion, and a lot of plastic surgeon opinions, to actually use staples in that region. Now we do some deep sutures, deep to the skin, but for the skin itself, we just want to pinch it because I want to make sure you don't lose any hair.
That was my question.
Yeah, it hasn't, is it a theoretical risk? Yes, but not really. Like definitely less than 1%, or I don't know. I haven't had it be an issue ever. What you can get though is itching of the scalp and some sensory changes that are some numbness essentially. That's the one thing I would say that sometimes annoys people. Yeah.
What's the difference between, it seems like there's an alternative way to fix the
Upper eye. Right, so it plays into really like when somebody's unhappy with they'll come in for their eyes, they'll be like, I'm not happy with their eyes, and they'll think they need just eyelid surgery, but that's what I'm saying, it's not always. So if I take this incision and remove the skin all the way out to here, what's gonna happen to this brow? It's gonna bring it, I can get rid of the excess skin, but that brow's gonna be even lower. So it's not a good option, so you gotta think about that. So sometimes you got to do the brow lift, which takes care of this part, and then get rid of the upper eyelid skin. So so this patient is a patient of mine that did a temporal brow lift, the one I was talking about with the 5 centimeter incision. And if you focus on this area here, you can see she didn't have any upper eyelid. She didn't want the upper eyelid surgeries done. And you can see when you look in the front, her eyelids look a lot more open, and it still looks very natural, and the brow is in a higher, better position, a more youthful position of where it was when she was younger. So, any more questions about that, or is that?
When you do the surgery, what if you already have a high forehead? Do you want to make it high?
Exactly right. So that's where you will do it in the hairline, and I mentioned that. So when you have a really high forehead, and I have an example of that. I'll get to it in a sec.
Is that just brow or also upper eyelid as well?
This one's only a brow lift. Nothing done for the upper eyelid. And the proof's kind of right here. Look right here. It looks exactly the same essentially, So, and usually I would have, she could have got a slightly better result with doing the upper eyelid too, but, it wasn't in the budget. And, a lot of times we address that excess fat here, but still it's a great improvement, I think. And actually I can't argue with her. I think we actually ended up,
Outer corner of her eyes have improved.
Yeah. Well, it's because the skin hanging here is not covering them anymore.
And you're able to do that with lifting the muscles?
It's really lifting the skin, and then there's a layer of fascia called the galea that we suspend this from. So it's the skin and that fascia that's deep to it called the galea that's suspended. Yeah. So upper lid blepharoplasty is a fancy word for really upper eyelid surgery. This is the one procedure we could do in the clinic under local. It's safe to do that if that's all you're doing. And it really is meant to address the excess skin and fat. Plastic surgeons used to kind of take out all the fat in the upper lid, and it caused a very aged, hollow appearance. So we don't ever do that anymore, and that's not what we're looking for. And very rare, sometimes in the Asian population, there's a few patients that are really full in the upper lid, and you may consider it. but generally we focus on this, what's called the medial fat pad, because that one tends to get more prominent and we'll take out the fat there. But otherwise we're taking out just the excess skin. And has pretty minimal recovery. And I have again, you can do this under local, but often I do it at the same time under general anesthesia when we're doing, as another ancillary procedure to with a facelift, for instance. In very rare cases, sometimes people's skin is so severe it hangs over the eyelashes and causes blockage of vision. In rare case, I haven't had this happen yet, but sometimes it could be insurance covered if it's that bad. But you have to have both photos and proof that it's blocking your vision, so it's difficult. And here's just a couple examples. I picked one female and male that had it, but just focusing on the excess skin here, you can see it just kind of opens up the eyes. You can see the eyelashes better, and this is a male example as well. And then I think this is a result. This is at 1 week. So you have some of the bruising, but I think I just brought this. I thought it was a good picture because this is easily covered with makeup. Even though we operate only on the upper lid, the blood and the bruising actually goes in the lower lid. So I thought it was important to see that, and thought it was a good example. Again, just kind of opens up the eye a little bit and gets a cleaner line right there. So I could kind of jump forward maybe and do that. So she had the upper lid and brow done, and see how high her forehead was, quite a bit higher, and so I did a hairline on her, and it's really hard to see that incision, and you could kind of see, but she also had a facelift. This is part of the facelift part, but you could kind of see how much the improvement is there. But I'm trying to focus that slide. Unfortunately, the pictures are rearranged, but I was trying to focus on this area here. And then also I could bring the hairline down a little bit with this procedure as well.
So you actually changed the hairline and brought
a little bit forward. Yeah. By when you do a hairline incision, you could bring this forward and cut away the skin this way, right? And you could see how well it heals. It's very hard to see. It's.
But does it pull from the back anymore?
Yeah, we pull the hair forward.
No, I meant like.
Oh no. Mm-mm. Mm-mm. So sorry about that. It's technical, but computer Mac PC problems. But so lower lid blepharoplasty is really just addressing the lower lid. The main things we look for is excess skin, excess fat as well, and then that tear trough. We're trying to cause a blunting of that tear trough deformity, and the incisions could be healed, are also very hidden, and that's something. Both the upper eyelid and the lower eyelid, that skin heals better than any other. It's essentially scarless. People who have had the procedure before, I can't find their incision, even when I use loop magnification. So it heals really well. And then sometimes we even just do incision behind the skin of the eye, into the eye, especially when we're just trying to address fat. And that's an example here of a young, that's more typical in a younger patient where you're just trying to remove the fat, and that's with an incision inside the eye, so nothing outside. But this one, for instance, the older patient didn't have a lot of fat, but had the excess hanging skin, and her incision is right along this, what we call the ciliary margin, or right along the lower lid, and it just, you can't see it.
How much is that surgery?
So the upper and eyelids, the lower eyelid tends to be a little bit more complicated and need to go under general anesthesia, so it tends to be more expensive. The surgeon's fee is roughly $5,000 for the lower lid, and for the upper lid $4,000. And because the upper lid you could just do in the clinic, it ends up being very, you pay a tiny bit for the procedure room, but it's basically $4,000. No, total. Yeah, when you're gonna spend $1,000 on filler, yeah, we do both. We don't leave you with one and then hold you hostage. You're like, yeah, it's gonna be $10,000 for the second one if you want it. It's up to you though. Yeah.
That incision along the lower,
Yeah.
doesn't affect the eyelashes?
No, I mean that's again, you got to be delicate and careful and plan the incision appropriately, but it's right under the eyelashes, so no, because that's we don't want you to lose your eyelashes.
So how does it heal? Do you glue it back together?
Sutures.
Really?
Yeah.
Do people feel like they have bleeding eyes at one point?
Some people, we have used eye moisturizers, actually just over-the-counter refresh drops work really well. And with that, then, it's rare. Sometimes, yeah, you could feel like, especially what we do sometimes is tighten the lower lid. In that case, sometimes you could feel the suture. It's temporary and, it tends to get better. But yeah, that's sometimes a little bit. But it's not a huge complaint, honestly.
Does the health of your eye have an effect on your?
Yeah, I mean, we try to make sure, we want to make sure, no. So it shouldn't by itself affect the health of your eye. And as long as you keep your eyes moist, that's an important thing. I always ask about dry eye symptoms. Now, feasibly, if you're removing skin and that you remove too much, can you worsen the dryness? Of course, but you try to tease that out first, optimize it so that, make sure they've optimized their dry eye symptoms. And then if you use a lot of moisturizers, because sometimes temporarily after you do the upper lid procedure, you can have a little bit of opening, especially while you're asleep, but it's very temporary. So as long as you stick to those rules, then people do pretty well. And then this is just a 6-week post-op, but I like this example, and this is the one I was alluding to. So this patient had a tattooed brow really high. You can see that distance; it's just already really high. So if I raised her more, it wouldn't look good. So in this case, I had to extend it, from the upper eyelid onto the brow to get rid of that, what we call the lateral hooding. But, and this is just 6 weeks post-op, you cover it with makeup very easily, looks much improved. And then with the lower lid, really, she was just bothered by the tear trough. She didn't really have a lot of excess fat or skin. So I just built up the cheek here, and that was with the fat grafting. So again, you got to tailor each procedure for what the patient needs. And you could get very natural looking results if you pay attention to these details. Here's a close up. Yep.
I know there are ophthalmologists who do plastic surgery of the eyelids.
Mm-hmm.
So in UCLA, if I want to do, fix my eyes, do I go to ophthalmology or do I go to plastic surgery?
Obviously, I'm biased, and so actually, I actually wrote a paper recently about simplifying blepharoplasty, and I did it with an oculoplastic colleague of mine. His name's Chris Suman, a great surgeon too, and he does eyelids. So a lot of these procedures were solely within the auspice of plastic surgery, and other fields started to kind of pick them up over time, and it's a relatively more recent thing. And honestly, it's surgeon dependent. So, you gotta just kind of go with your meet the person who you feel comfortable with, look at their before and afters, look at their reviews, and decide who you're comfortable with. As a plastic surgeon, and I was trained in plastic surgery, I learned the whole body. But I did I did 6 years of just plastic surgery residency. So the training is very different. So you're gonna get different perspective to some degree. And so I spent the 6 years in the plastic surgery residency, and then I did a fellowship just in aesthetic surgery, which is pretty rare, honestly. There's not a lot of people that do that. There's a lot of people. I could have started practice right after my residency, obviously, and then chose to do that because I had special interest in that, and I want to be as good as I possibly could be in that. The oculoplastics, they do ophthalmology residency, which is where they do general ophthalmology, glaucoma, everything having to do with the eye, and then they do a 2-year oculoplastic fellowship. So that's an important question, and the same thing applies to facial plastic surgery, right? They also do eyelids. They are ENT doctors that did their ENT residency and then did a facial plastics fellowship, which was 1 year. So, it's surgeon dependent at the end of the day, and their training. So the training is exceedingly important. Look at their pedigree, look at where they went, look at their before. Look at as much information as you can is all I could say, and go with who you're comfortable with, that you can communicate well with, and what they're saying makes sense to you. I think. I don't know how else, because I can't say that every plastic surgeon is better than every oculoplastic surgeon. That's untrue. So, and then this is just a male. Often males are really afraid about looking, overly done and surprised and everything like that. But this is a relatively even subtle result, but it just cleans up the eyelids and looks very natural. And another important thing with aging is you see this distance between the lower eyelid and the cheek. That's a long distance there, and how much we can correct it, and it's a much more youthful appearance. this one for privacy reasons, I would have liked to show the whole face, but I couldn't. So I'm going to move on to face and neck lifts. So the face and neck lift is a very powerful procedure and really addresses should address the cheek, the smile line, the jawline, the neck as well. So every facelift really includes a neck lift. And all the incisions are right here centered around the ear, and they hide really well. And you're going to see some examples, and then down the scalp as well.
Just one continual incision?
Yeah, it's all connected, yeah. Now, if we're doing just a neck lift, for instance, though, the incision would just go around the lobule here and then be all around the hair here, so everything behind the ear. But when you're doing the face, you have to access the cheek and everything else, because, and what it was, I think a lot of people and a lot of people that are afraid of the facelift and have that, that windblown look, or their mouth looks wide, everything. That was really a procedure where they were trying to just pull the skin as tight as possible. It's changed a lot and gotten a lot better. And we really work on repositioning the tissues deep to the skin, and it's called the SMAS. And a big reason I went to Dallas for my fellowship was the guy that created a procedure called the high SMAS facelift, is who I trained with. And I just thought it was the best, that gave the best results. So, and I want to learn it's a little bit, not everyone, it's considered a deep plane facelift, and you're closer to the facial nerves, which is one of the fears of getting a facelift, that you can injure one of those nerves and it causes a paralysis. I actually wrote a paper on that, and it's very rare and temporary in, almost all cases. But it is something to consider. Yeah, I think the results are very powerful. So this is just an example of one at 10 days. Blocked her eyes for privacy reasons, but this one, she's obviously wearing some makeup, but you could focus on the jawline here and everything, in the cheek position. It's an important result. But another big reason I put this picture up is she had a prior facelift. Now, can you guys see this white line there? That's her old incision. And it's a poorly planned incision. Again, importance of paying attention to this stuff. So the new incision, this is just 10 days out, so you could see it pretty well, is right there. So in the natural crease that you would have between your cheek and your ear. And then look, she lost her. This is another stigmata of a bad facelift, is she lost her what's called the tragus, that normal little outpouching you had. So I had to try to recreate that and restore that for her. But these are all, and she kind of lost her sideburn a bit in the prior procedure, and it's a little blocked here, but try to restore that a little bit. But these are all stigmata of bad facelifts, so I thought it was a good example to show you guys, so you kind of have some information about what to look out for and stuff like that. If you're evaluating people's before and afters, it's an important thing to pay attention to. This is another patient of mine that underwent a face and neck lift. I really like this example because it kind of shows you how much skin you can remove. You see that mole right there? It's all the way back there behind the ear. So you kind of get a better understanding of how the facelift works and how much, that's the only way, no non-surgical option is going to get you from here to there. So it really, because everything, this was direct fat excision and everything to try to shape all the tissues deep to the skin. It's not a skin procedure. It's really, what we're doing is shaping everything on the face and putting everything deep to the skin in a good position, or cutting away fat in this case. And then just getting rid of the skin excess. So, and that's the key. You can't get a good scar if you're putting tension on scar. So that's the rule number one in plastic surgery, is that you can't, scars with tension don't scar well. They widen, they get more visible. So you can't put tension on these scars. And that's why the first patient that had that white line, that's from, too much tension on the skin. It shouldn't be visible like that. So, just important concepts to keep in mind. And again, just to get from here to there, and it should all hide really well. It should preserve this. You should preserve the ear. Yeah.
Do you do implants, like chin implants?
I have an example of that. Yeah. Yes, I definitely do, in the right patient, and I'll show you exactly what to look for that. on that when I get to that last patient that had the chin implant as well. It was actually the same one that I did the brown blood field recognizer, but yes.
On the underneath,
Mhm.
sometimes there's fat that accumulates, and I heard that there's a muscle. Do they cross each other or something?
The platysma.
And the incision is down there. Do you do the incision?
Yes, yeah, I do the incision under the chin often, so I could get those two muscles together. You'll see a good example of it when I talk about the neck lift. You don't see that. A lot of people have that incision from childhood. Actually, they fall on their chin and they have it right there, anyways. So you don't always have to do it, but anyone where you want to address those muscles and/or a lot of fat under the chin, it's the right thing to do.
But on this example,
Yeah.
the impression I had was that the incision was made behind the ear.
You do
So-
both.
Oh, you did both on her?
Mm-hmm.
Yeah,
Mm-hmm.
it's excellent.
Thank you. Just another example. Face and neck lift. She also had her upper eyelids done, you could see, in the lower eyelid. So it's important sometimes. So the last one was just a face and neck, like nothing got done for the upper eyelid. If you focus here, it looks the same. She has a little bit of makeup. It's a little bit of cheating, I'll be honest, but obviously this is not makeup. But this one, had the tighter lower lid a little bit, and the upper lid as well got rid of the excess skin. And then again, you could see the nice improvement on the jawline, the cheek position, she's more heart shaped, right, into her face. It was like really heavy down here, and now she's a lot more heart shaped, but she still looks like herself, I think. I mean, she doesn't look like she had a facelift. You would never know. You're like, hey, you look better now. There's just a side view again, just really sculpting the jawline and everything. And again, you can see the lower eyelid. It's a lot better. Yeah, it's an important part. It's not just a skin procedure, like I said. It's shaping the fat deep to the skin, putting it in a good position, removing it where it's necessary, and then getting rid of just the excess skin. You don't rely on skin at all. Actually, you just get rid of the excess. Because you take out all that fat, there's a lot of excess skin left, so you got to get rid of it. And no non-surgical options are going to address that. There's no way to get rid of excess skin like that. And then I like this example. This is a patient that's quite a bit older than the usual patient, and and it may not present as well for you guys, but hopefully it does. Her skin, you could see a dramatic improvement in her skin. And there's not a lot of research in this, and I don't want to oversell it, but I mean, I see this frequently, and just like you can get chemical peel, a laser on the surface of your skin, surgery causes an inflammatory reaction in that remodeling on the deep surface of the skin. So I see that very frequently, especially now that we're doing a lot of fat grafting procedures too. There's stem cells with that, and a lot of people think there is an improvement in skin. So it's something to keep in mind. So I always if somebody's going to get a facelift, I don't, unless they really have really sun-beaten skin, but this patient didn't have a chemical peel, for instance, and the improvement in her skin's dramatic. I like it for that example.
That's just from the face.
Yeah, yep, and you could see how much the wrinkles improved significantly.
Is there an upper limit to when?
She's getting there. I mean, there isn't an upper limit if you're healthy. So there really is not, but I mean, there does become so it does, I will say it does compromise your result a little bit. At the end of the day, it's sometimes, a lot of people will argue it's better to get the facelift younger because you get a better result that lasts, and you get to, enjoy it more for many years, if that makes sense. Whereas you wait so long to get it done, and it's the benefit may not be as much. And the result tends to not be as good. It's hard to, this result, I think it's a big improvement for her, but I mean, it's not like her, And same thing, you can see in all these, the skin is improved. I mean, their skin looks smoother and better. So a lot of people don't talk about that, and I can't give you research and science behind it, to be totally honest, but I see it.
So maybe you don't need the skin treatment.
Yeah.
Yeah.
And you could always do it later. And it's safer to do it that way because you're totally healed. If you burn too much and it's trying to heal too many things. So yes, I agree with that.
I hear that the ear is still growing.
Yeah, so I should have put one example of that. So none of these had that. So sometimes I do a lobe reduction at the same time, or sometimes I do fat grafting. If somebody has like an ear with a lot of excess skin and they kind of lost that, fullness in their earlobe, not that that's when it's kind of looks kind of a little bit just more like saggy skin. Sometimes it's better to just add fat to it. But we go over that together and make sure we tailor it to something that you're trying to achieve. But yes, definitely it's a good time to do an earlobe reduction too while you're there. So yeah, this was the patient again, that higher hairline, brought that forward. So she got the brow lift, she got the upper lid, and the facelift as well. And again, just a dramatic, she had the chin implant. So whoever asked about the chin implant, yeah, there you go. So the thing to look for, so look, if you follow this line from her upper lip, lower lip, and then if you had to imagine a straight line going down that, you want the chin to be in line with that. So it's an angle a little bit like this, and so now you could see that. See, if I took a ruler across here, it's like a straight line to the chin now. Does that make sense? Whereas here it's deficient, so I look for that, and I recommended a chin implant. She was a little hesitant at first. People don't like the idea of it sometimes, but she loves it. It makes a dramatic improvement, and look, it helps just the jawline and neckline just dramatically improved.
What's in the implant? Or what's...
It's silicone, and it's firm. So the nice thing about it, you can easily remove it. Let's say you happen to hate it, and you need that incision anyways, often for the neck to address those muscles. So you don't have any extra incision. So there's a little downside. You paid, obviously for the implant, and the surgery. The implant's pretty cheap though. It's a couple $100, and then the extra cost of surgery is usually, if I'm doing it as an ancillary procedure, it's a couple thousand to add on. So it's when in the right patient, like you want to do it, and it's the right thing to do, and it dramatically improves the result. It's something to consider. But yeah, she also had the brow lift and the upper eyelids done and everything. And again, I think
the chin implant also improves the shape of her nose. It's interesting.
yeah, because exactly right. So I do a lot of nose surgery too, and I have a talk on that. And there's an example of a patient where you did nothing for her nose and just did a chin implant, and it looks like you did her nose.
Right.
Yeah, exactly right. Because it's all a relationship. I mean, I'd love to take that tiny bit of bump down. Maybe one day she'll let me or not. But I think she looks great though, and she's really happy, and that's what's important. So this is just an example of a neck lift. I didn't do her lips. I don't know if they're natural or not. It doesn't look bad. It's a little bit more done than I usually do. But here's where I want you to focus is on these. These are called the platysmal bands. You can see it here, and it's often you think it's just hanging skin, but it's often actually the muscle as well as that. So you get a dramatic improvement in the. She didn't have a chin plan, anything else. This is just. Through the a neck lift and getting those muscles together, and you could see in the front too. They're essentially gone. It looks just so much more youthful. In this example here too. For the neck lift, you basically it's around the ear and then down the hairline here, so it hides really well with your hair. Even people who like to wear their hair up, because the incision, there's a trick of beveling it in a way so that your hair can grow through the scar actually. So a lot of little tricks that you gotta that we've learned.
I was told that you shouldn't do the necklace without a facelift, and they kind of go together, and you just risky to do one without the other now.
Depends on what your goals are. So yeah, in general, I think in a younger patient you don't need to change much here. It's going to improve your jawline, the neckline a little bit. Does it do as much? Now, if you have a lot of jowling, like really heavy jowls, then you should get a facelift. But if you really just, some people just want to improve their neckline, and it does it. And it doesn't prohibit you from getting a facelift later either if you want. But I wouldn't say one ruins the other. But in general, I'd say most people are better candidates for a face and neck lift as a general rule. But there are the select cases, and especially males too, for instance, they don't want to do the facelift part, and it's really just their neck that bothers them. So, it's a reasonable option to just do the neck lift.
So the platysmal bands, those are muscles?
Yeah. So it's a muscle. It's this muscle. Yeah.
Why is it
Not very. Why do we have it?
Why does it become more pronounced the older we get? Is it the
I think
muscle itself or the
no. It's so every muscle has a fascia around it. which is just a connective tissue layer. And I think that as that connective tissue layer, nobody knows like the actual true answer to this, but this is the theory, is that that connective tissue layer gets more loose and stretches, and then so it's allowed to pull away. And as you use it more and stuff like that, it like, every muscle contracts, it shortens, right? You take a two distance, it shortens it, and it wants to pull away, like it wants to bowstring, right? And so over time, as that thing that normally was holding it up, it just slowly gives away. Yeah, so it does, and it's very common, in another sign of aging. It bothers some people, again, this is all just information for you guys that, to mull over, and, every patient's different, everyone's goals is different, and not here to judge as far as what's, better or worse. It just, these are all options and things that we can do, if certain things bother you as far as that goes. So, I was just wanted to touch on rhinoplasty. It's, again, another surgery I do a lot of, and there is some aging of the nose that we talk about. Is like you tend to get some drooping of the tip mostly, and that makes the bump look more prominent as well. So getting it into a more youthful position. Again, typically we do it with a small incision right here, but it can have dramatic effects. And this is just an example of that, where you can see this happening via male, but just getting the tip up a little bit, but again, it should look very natural and not look done. So some of the latest advances I want to touch on, one I think somebody mentioned already, is fat grafting. And this is something we've definitely written about. This is something I did while I was in my fellowship in Dallas. And it's a lift and fill concept. Just like I told you before that, you have loss of fat in certain regions, we want to restore fat. Now, this is so fat grafting means basically we take fat from anywhere in your body. Most people want to take it away from the belly and have some to give there. And we basically then inject it into the face. Now, it's kind of like sowing seeds. Not every seed may survive, but a lot of them do. And we say in general about 50%. So it helps, the ones that survive, it's permanent. So it's kind of like a filler, but it's also not, because it's not like, the filler is very, like every bit you put, you're going to see it, but then it slowly dissolves over time. The fat, it's a little bit more of guesswork, so you have to do it a little bit strategically. And I think it works really well around the cheek, for instance, and even in the smile lines, where you could go relatively deeper, because if some of the fat doesn't survive, it can turn into hard nodules and stuff like that. But if you go deep, it tends to not be an issue at all, and it's a great way to really enhance the results. So something we're doing more and more, and with a lot of research is going on the best ways to do it, and something that I've been involved with. So I think this is something that most plastic surgeons offer, and it works well. You definitely see an improvement with it. Yeah, and this is something you could technically get away doing it under local. Could be a little bit uncomfortable, because you got to first suck out the fat and then inject it into the face, and you could do it through tiny pinhole incisions. I tend to like doing it as sometimes I do it just in the OR. The extra amount you're going to pay to have an anesthesiologist and the safety of an operating room and nurse and all the bells and whistles, it's just worth it. It's not that much extra, so I tend to tell most people it's worth it small.
Immediately when you take it out,
We process it.
then immediately.
Yeah, we process it a bit. We spin it down, so we isolate the fat, and then we inject it right away. It's important. You don't want it to be without a blood supply for very long, and that's the reason some of it survives, some of it doesn't, because some of it will get enough blood supply to survive, and some of it won't. Fat in general requires less blood supply than other tissues, so that's how it works. And people are doing it more and more. You've heard of the Brazilian butt lift, for instance. That's basically it works a lot better in the face, because the face is much more well vascularized than the buttocks. So, and they have to do really large volumes on the buttocks, where it's relatively small volumes, depending on where you go for. It's not something I do really. I like focusing here mostly, but it's the same concept, and it's done more and more. So it's just, I think it's something. I think it works great in the face, and I do use it a lot, and I do counsel some of my patients that this is a good option to consider. So Kybella, has anyone heard of that? So this is an injectable fat dissolvent. So I was talking about adding fat, now I'm talking about taking it away. And so this is it's actually deoxycholic acid is found in your bile acid, which dissolves fat in your intestines. So they kind of isolate it. It's actually developed at UCLA. One of the doctors at UCLA, and it works pretty well. I'm going to show you an example of before and after. Now, the downside of it is it's an injectable, so you just do it in the clinic. It takes like less than like 20 minutes or so to inject it. It requires usually, so when in the trials, a minimum of 2 treatments, but 3 to even sometimes 4 to get the result you're looking for. And each treatment's about $1,300. And each treatment has a recovery time, so it does cause some swelling initially in the first week or 2. So for instance, when we do under the chin here, your chin will be bigger for 1 to 2 weeks. But eventually it can get to this result. So this was 3 treatments. And it's a nice improvement. It didn't require surgery. Now, I always compare this to chin lipo. So in the clinic even, I can take a liposuction cannula and suck this fat out. And when you're talking about 3 treatments, the price is almost equivalent, is essentially equivalent actually, and it's 1 recovery. So, it's a good answer for somebody who's, for whatever reason, really just wants an injectable and it sounds better to them. They don't mind having it, you have to space them about 6 to 8 weeks apart, but you don't mind having 3 recoveries and 3 treatments. Now, each recovery tends to be less than the prior one, just because there's probably less fat that's dissolving at that point. But yeah, it does work. It's brand new out on the market just this last year. So I thought I'd tell you guys about it. But we do offer it at UCLA, and this is one of my patients that got it done. Just some of the myths out there. The non-surgical facelift. I don't even know if it's still out there really much, but Thermage. A lot of these things come and go. For instance, Lifestyle Lift is out of business. The lunchtime lifts and everything. So it's your face. I think it's worth investing in. You spend a lot of money on a car. You're gonna look in the mirror every day, and it's gonna be for the rest of your life. So I think it's not. I think it's an important place to do research and spend the time and the investment in. And there's no tricks around biology. Biology is biology. So if that doesn't have downtime, I can guarantee you it's not going to have a result. You can't trick the biology really. I feel like a lot of people also are kind of enamored by it's laser sounds like a high-tech solution, but again, I think I emphasize it's really the same pathway at the end of the day, that whether it's laser is just high energy light that causes a heat burn rather than a chemical burn or a mechanical burn. So any common myths, any questions you guys have about like anything I can try to help answer or like clarify? Yeah.
The hair is an important part of facial aesthetics.
The hair?
Hair.
Yeah.
So who treats hair loss? Is it a dermatologist?
We all do actually, and we're actually working on getting a hair transplant program going right now at UCLA. So in plastic surgery. So yes, some dermatologists do it, some plastic surgeons do it. And there's some centers that focus only on hair transplant, like Bosley. It's mostly aimed towards men, but yeah, they're out there. Yeah, so for the hands, some people, there's fillers or fat grafting that people have done. The fat grafting, I can say I've done it. There's a lot of swelling initially, for sure. And it does give you a result. It's more variable though. I'd say fat grafting to me works better on the face than the hand. Again, probably blood supply reasons, but it's doable. The other common thing is people do like Radiesse, a filler. The nice thing about the face, really, if you think about it, is like it heals really well, and we can hide incisions a lot around like the ear and stuff like that. And not every part of the body works that way. Like for instance, like the brachioplasty is like one of the worst scars in plastic surgery, and like for hanging skin here, unfortunately. But that's just so as far as the knee, it's probably somewhere in between. But areas of high motion like that, like the arms and legs, tend to not heal scar as well. So it's something to keep in mind. But I do brachioplasties in medial thylus, for instance, for usually people with massive weight loss, though, that have a lot of excess skin where they're willing to trade off a scar for a better shape. Yep.
And that's what you charge for a puff
$150, and $150 and it applies towards any procedure you get done, whether it's even Botox or anything. So how much I charge for a consult is $150, but it applies towards the whatever treatment you get. I mean, if we just go in there and chat, then you're just paying for my time, I guess. Uh-huh.
You said you could not exercise away wrinkles, but jowls aren't wrinkles. Can you exercise them away?
No, they tend to, no. I haven't, if anything, if you do, you'll still be left with the excess skin there. You may, if you lost a lot of weight, for instance, you'll maybe become a little less full, but then the skin would still be hanging. You have that ligament, and if anything, that you may have excess sagging skin in that case too.
And is it only overweight people that get jowls, like you said, people get them?
Yeah.
In general, I know being overweight is not good, but is it better to be like medium than very thin in terms of looking younger?
I wouldn't try to, I mean, it's a reasonable question actually. And yeah, I mean, some people, and it's person dependent, if they're like really thin, it like makes them look more gaunt and a little bit more aged sometimes. There is a fullness you get with extra weight, and that's really individualized and person dependent. You'd have to I can't guide you on that. I would say in general though, I wouldn't try to just have a healthy habits and have a healthy lifestyle. And if you're gonna have any surgery, try to maintain that and try to stay at a stable weight, be at a happy weight, whatever's a happy weight for you, before you have a surgical procedure in general. Now if 10 pounds, 20 pounds difference is not going to make a huge difference. You shouldn't hold off, surgery for years trying to lose, 10, 20 pounds. And if, you're waiting that long anyways, you're at your happy weight probably. So.
Did you mention the price of the facelift and or the neck lift?
I didn't. In roughly around, so the facelift is about $20,000, and the neck lift, it depends on how much work it is, because a lot of times it becomes very similar to a facelift again, and it varies a little bit more, but I'd say around 12 to up to 15 sometimes after anesthesia, because you got to pay for anesthesia time, the OR space, and everything else. But I think in general, honestly, if you shop around, our prices are very fair at UCLA. We try to be very middle of the road. We're not necessarily the cheapest by any means, but especially Lifestyle Lift, but they went out of business anyways. But I think if you go especially, and I have a clinic that I see patients in Beverly Hills, so I know the prices in Beverly Hills, and sometimes they get pretty exorbitant. I mean, there's some people charging $50,000 to $75,000, even you'll hear of $100,000. I don't know. Look at the results, see if you think they're any better or if it justifies. But, yep.
What are the risks?
What are the risks?
Risks for a facelift?
Again, I'd say the one that people worry about the most is facial nerve injury. But that's, I wrote a review paper on it for plastic surgeons. It's very rare. Somebody who's very familiar with anatomy, it really, if the most common thing is to have a temporary paresis of the lower lip, and it's about 10% of the time, I would say, and it's in people. You only see it in people that are full dentured smile. So some people, when they smile, their lower lip lowers as well, and you see their lower teeth as well. In that particular case, they have about a 5 to 10% of having what looks like a slightly asymmetric smile, because the one side doesn't move down as much as the other. It usually lasts about a month. That's the most common nerve injury, and permanent nerve injury is exceedingly rare, very rare, because there's a lot of nerves in your face, and to cut every single one, I mean, that's very difficult, and very rare, 1 in 10,000 probably, or 20,000 or something. Infection's very rare because the blood supply is so well in the face. It's not zero, but it's rare, definitely lower than most surgeries. The other thing that is the most common thing is called a hematoma, and that's a buildup of blood. Now, because your face is so vascular, there's a lot of blood vessels there, and especially people if they have high blood pressure, and in males particularly, they have a higher risk for a hematoma. Now, a hematoma, if you catch it early, is really of not major significance. You just have to drain it out. Sometimes that requires, if it's big enough, you would want to go back to the operating room. and if it's smaller, sometimes you could just kind of push it out, open up a little small part of the incision and push it out. No, so it's variable. So an important thing, and actually something I should mention, is that I keep every facelift patient overnight. So I operate mostly at the UCLA Surgery Center, and we have a overnight facility there, right? And it's actually the only facility I know in Los Angeles that you don't have to go, because the other one that people commonly use is called Serenity right here in Santa Monica, but they have to get transported from one place to the other, and then God forbid you have to go into an operating room because you got a hematoma. It's another transport and time, and so it's really nice, honestly, and it's way cheaper than Serenity. Actually, the cost to stay overnight at UCLA is only $500, and you have Ronald Reagan right there. You have nurses. You have everything, which the safety margin, I got to tell you, is I've been to both, and it's significant. So it's a huge plus and a big reason I like operating outside of UCLA, or at UCLA. I mean.
How often do you yourself check on people after you've done surgery?
I typically, so the other nice thing, we have a lot of eyes and doctors, because I teach plastic surgeons essentially, right? So I'm teaching residents and everything like that. So between all of us, you get usually multiple visits in that. So you get usually one after surgery, and then one definitely 100% the one the morning of. Because the other thing with the facelift, we put drains in, and we want you to stay overnight so we could take them out the next morning.
And what about like 3 days later, 5 days later?
Oh yeah. So then as far as your sutures and everything, we have to get it out somewhere around 5 to 7 days. So we see there, and then it's kind of as needed. So often it's 6 weeks, and for sure by 3 months, and then at 1 year. I mean, it's if somebody has an issue or something, I'm just giving you the average. Yeah. Yep.
Are you familiar with dermal and is that a fad? And what is your
Dermal welding?
dermal welding?
Oh yeah, like microneedling.
Yeah.
Yeah. Again, so that's that same, like, just like we're talking about a chemical burn, this is like another way to injure the skin and cause it like a little bit of inflammation. Now, the results are pretty minimal, but it's probably a very mild result. It's nowhere near like the type of burn you'd get from a TCA pill, for instance. But it doesn't really have a recovery either. It's a very minimal recovery. So it's not going to be dramatic. It can have maybe some mild improvement. It hasn't been done long enough. There's not enough science behind it for me to give you like great medical advice behind it. However, but it makes some sense. That's biologically.
I mean, because it seems like it's a fad, but it's new.
I think it actually, like, it's not like anything that novel, or it just became more popular recently. But again, the results are very minimal. I mean, you could just even go on Amazon, buy a roller, and I mean, very questionable results. But it's not expensive either, so, and very little downside. Just make sure it's clean and don't get an infection. Any other questions or anything, or need me to? I think. Hold on. Make sure. Okay. Yeah. Just thank you, and I have a website. So if you want more information, I have a lot of information on the website, drjasonplasticsurgery.com. And